Okay, we have here the hemolytic anemia. So, we have the different tests that will identify our hemolytic anemia. So, first one, we have here for immune hemolytic anemia. So, that could be identified by our your antiglobulin test or your Combs test. Then we have also here your PNH, paroxysmal nocturnal hemoglobinuria, could be identified here by our sugar water test or your HAMS test. Could also be by your acid hemolysis test. Then hereditary spherocytosis could be identified by our osmotic fragility test or even your autohemolysis. Then for our enzyme defects, that could be identified here by specific enzyme assay. Just need to determine the concentration of each of the enzymes. So if the concentration of that is decreased or below than the usual, the normal or the normal values, then that would be identifying that one the patient would have deficiency for that particular enzyme. But for example, glucose 6-phosphate dehydrogenase deficiency. So if the patient would have here the decreased concentration of the glucose 6-phosphate, then we diagnose someone to have a glucose 6-phosphate dehydrogenase deficiency. But then we have also here the identification of your hemoglobinopathies. So that's for the different abnormal hemoglobin. So for the hemoglobin S, okay, for your sickle cell anemia with related to your hemoglobin S could be identified here by our solubility test. So you can have here your sodium metabisulfite as one of your reagent for the solubility testing. Okay, another one, hemoglobin electrophoresis will help you identify specific na mga hemoglobin. So, increased concentration of that will identify the specific na hemoglobinopathies. Like for example, if you have your increased hemoglobin S, okay, hemoglobin C, so that will help you identify each of your abnormal hemoglobin, specifically identifying them by your electrophoresis. Alkali resistant test is for hemoglobin F. Heinz body is also here for the problem with your hexose monophosphate chain pathway for identification of your intracellular hemoglobin precipitates. And your heat stability test for those hemoglobinopathies or for those hemoglobin problem which are unstable na mga hemoglobin. Okay, then we have also here the hereditary spherocytosis. So, hereditary spherocytosis defective in the spectrin. Okay, so spectrin is needed in order for you then to maintain the biconcave shape of the RBC. So, once your RBC becomes sphere, that would be increasing the sequestration of the spleen because that one would be recognized by our spleen having abnormal morphology. So, increased sequestration of the spleen result to your splenomegaly. So it also identified by MCHC more than 36 grams per DL. Okay, test osmotic frage is increased. Autohemolysis here could be corrected. Your blood could be corrected by both addition of your glucose and ATP. Your that direct antiglobulin test, it will give a negative result because again, this is not an autoimmune disorder. This is just your membrane defects. So we have your autohemolysis here. So some of the tests. So for the glucose 6-phosphate dehydrogenase deficiency, that could be corrected. The blood of the patient with this problem would be corrected by addition of the glucose. In the case of your pyruvate kinase deficiency, that one could be corrected by addition of the ATP. And for your hereditary spherocytosis, the blood of the patient could be corrected by addition of both of your glucose and ATP. Another membrane defect, we have here your hereditary elliptocytosis or your ovalocytosis. So this is characterized here by the problem defects in your membrane protein band 3 and that one would have your defects in your cytoskeleton. To test osmotic frage also increase that would have here the negative result because again this is not an autoimmune disorder but rather a membrane defect. Hereditary stomatocytosis or the presence of your mouth cell. Okay, so that's other name for that is your hydrocytosis. That basically problem related with your imbalance in your electrolytes, sodium and potassium. So what we've discussed in your mouth cell stomatocytes. That also problem here with the absence of your Rh antigen, your Rh null, characterized by the absence ng lahat ng antigen ng Rh. Wala siyang C, wala siyang D, wala siyang E na antigen related to your Rh blood group. So osmotic frage also try to have your increased result, and your that direct antiglobulin test will have your negative result because again your Hereditary stomatocytosis is not an autoimmune disorder, but rather this is a membrane defect. Okay, then we have also here the enzyme defects. So enzymes are needed for the RBC survival up to 120 days. So one of the enzymes that is very important for the RBC survival, we have your glucose 6-phosphate dehydrogenase. Okay, so, or even the pyruvate kinase. Okay, in the absence of the enzymes, basically when the RBC has been exposed to your oxidizing agent, okay, last in a case, for example, in severe infection, inflammation, metabolic disease, or even drugs, it would result to the rupture or the lysis of your RBC. The first one, na pinaka very prominent na enzyme defect, would be your glucose 6-phosphate dehydrogenase deficiency. Glucose 6-phosphate dehydrogenase is needed for your hexose monophosphate shunt pathway in order for you to produce NADPH. This 1-NADPH provides an energy for your glutathione in order for that to be converted to the reduced state, which is the functional state that would protect the RBC against your oxidizing agent. In the absence of your NADPH, you don't have glutathione or you could not recycle your glutathione, and therefore, once you're exposed to that oxidizing agent, the RBC will going to rupture, producing here your hemolytic reactions. We have here the test to diagnose someone with the glucose phosphate dehydrogenase. First one, we have your Heinz bodies. Heinz bodies are precipitated globin that, because of the exposure to your oxidizing agent, in the absence of your glucose phosphate dehydrogenase enzyme. Another one, we have your fluorescence spot test. So pag wala kang glucose phosphate, wala kang fluorescence, negative for that. Dapat, kung may fluorescence, which is a positive result, okay, negative is your walang fluorescence. Pag walang fluorescence, it would signify this is related to your glucose phosphate dehydrogenase deficiency. Ascorbate cyanide test. For the glucose 6-phosphate dehydrogenase deficiency, it will give here a chocolate brown na color na solution. Normal na blood would have here, okay, reddish or red color na solution. Another one, methylene blue test is also, I will give a positive result here with your glucose 6-phosphate dehydrogenase. Then we have also here your pyruvate kinase deficiency. Pyruvate kinase is the enzyme which is needed here in order for you to produce your ATP production. ATP needed ng ating RBC in order for that to survive for 120 days. Ginagamit ng ATP for your sodium potassium ATPase pump, which try to regulate the level of your sodium and your potassium in and out of the cell in our body. Okay, now we go to your immune hemolytic anemia. Okay, so malaman mo kung immune hemolytic anemia because it will always give a positive result for your direct anti-globulin test or your Coombs test. So we have here different types of our immune hemolytic anemia. You could have here warm type, could also have here the cold type. Warm type is identified by your antibody in the form of your IgM antibody. So that may be related here to your SLE, systemic lupus erythematosus. Okay, the cold type, on the other hand, warm type is IgG antibody pala. It is reactive at 37 degrees Celsius. Cold type, on the other hand, would identify as antibody problem with there's more of the IgM antibody. Sample for that, we have your paroxysmal cold hemoglobinuria. This is characterized by the presence of your cold biphasic na hemolysin. Itong nagkakos ng lysis ng red blood cells natin. And you call that one as your Donat-Landsteiner, which is your cold hemolysis. This is your biphasic na hemolysin. And this one is being produced by someone na may paroxysmal cold hemoglobinuria. Another one called agglutinin disease, called Heme agglutinin disease. Okay, diagnosis of your immune hemolytic anemia would be characterized by reticulocyte production index more than 3. Okay, ito palagi, basta mag-positive ka sa direct anti-globulin test or the Coombs test, that would be always related to your immune hemolytic anemia. And increase na reticulocyte count, that would also related to your autoimmune hemolytic anemia or your immune hemolytic anemia. Okay, then we have here your cold heme agglutinin disease. So this one is characterized here by the presence of your IgM antibody would have the same manifestation with your paroxysmal called hemoglobinuria. Then CDA, congenital dyserythropoietic anemia, characterized by the RBC, young RBC in the bone marrow with several nucleus, multinucleated. So we have three types. Type 1 is your autosomal recessive trait. Type 2, ang pinaka-common form, which is characterized by HEMPAS or hereditary erythropoietic multinuclearity with positive acidified serum test. Type 3, on the other hand, pinaka-rare form. Okay, type 4 would be resemble here the type 2, only that it just differ with the structure and even the serological testing result. And lastly, we have your hemoglobin F. So F is for the fetal. This will help you identify the RBC of the baby versus the RBC of the mother once the baby, like for example, my hemolytic reaction. Okay, hemoglobin F is characterized here by alkali resistant. So, mean to say, pag nag-add tayo ng alkaline solution, like your KOH or even your NaOH, okay, if that one is your hemoglobin F, it will not be affected. Mean to say that one is resistant to your alkali. Whereas ang hemoglobin A, which is the maternal or the adult hemoglobin, pag nilagyan mo ng alkaline solution, it will lyse. Okay, therefore, that would help you identify, differentiate that one na nakikita mo is ang fetal RBC ito versus your adult RBC. Okay, that's for the hemoglobin F. So you can use your Betty alkali denaturation with the use of your NaOH, or we have your Singer alkali denaturation with the use of your potassium hydroxide. Okay, thank you.